Hi, this is Dave Katz with Therapist Consultants, and I have a tip for you. Today I want to talk about client retention or patient retention. You know, what makes people stay with you once they start with you? Well, if they see results, they'll naturally stay with you, but there's some other things you can do. The first thing you can do is give them a written report. Now, we use this as a colored brochure. It just tells them what their situation is, any extenuating circumstances, and what you plan on doing, and it has a list of all the number of visits that they're going to have. So if we're going to see them for 15 times, it lists it right there. Then on the back, it gives them any homework that you want to give them. You can make your own plan of care just like this, but you should give every patient a written report of findings or a written plan of care. The next thing you can do is, now that you told them you're going to have them come in 15 times, you can advance multiple schedule all 15 visits. So when they leave on the second visit, and you give this on the second visit, when they leave on the second visit, what you'll do is before they leave, you'll schedule all 15 appointments. Now, if you do those two things, do the written report and the advanced multiple scheduling of all 15 appointments, or however many you do, you'll find that your practice goes up and it never goes back down. Now, there's a few other things you should do. Mostly it involves the phone. First of all, you should send a reminder call or reminder text to anybody that hasn't been in the last week. Most often now, your software will be able to send a reminder text. So see if your software will do it. Send everybody a reminder text of their appointment if it's been longer than a week since they've been in. The next thing you should do, that's called a reminder call or a reminder text. The next thing you should do is called a recall. You should call every patient that's 10 minutes late, because perhaps they forgot about it and they're close and they can get in for the rest of their appointment. So call about, if they miss by 15 minutes, that's called your reminder call, and you can maybe still get them scheduled. If not, you may get them scheduled for later in the week, as opposed to waiting a while to do that call. And the last call you want to do is a reactivation call, and that is if a patient is dropped from under your care and they should not have, their care was not done, you should call them in about 3 months and see how they're doing. Some of them will have backslidden a little ways, not do so well, and you can get them under your care again, and it all goes to help the patients and build your practice at the same time. This is Dave Katz. Thanks for listening.